This segment of DelmarvaLife is sponsored by TidalHealth Home Care.
Well, if you've ever felt dizzy, off balance, or like the room is spinning, you're not alone. These symptoms could be signs of a vestibular disorder. Now, it sounds scary, but there's a specialized treatment that can help. It's called vestibular rehabilitation therapy. It's a targeted form of physical therapy designed to help people manage and even overcome symptoms related to inner ear disorders, concussions, and more. With us today is Colette Alton. She is a physical therapist with TidalHealth Home Care. She joins us to talk about this life-changing therapy that can be given in the comfort of your own home. Colette, welcome to DelmarvaLife.
Hi, thanks for having me.
So let's start off with the obvious question. What exactly is vestibular rehabilitation therapy?
So vestibular rehabilitation therapy is a systematic and progressive exercise protocol that helps restore the normal coordination of your eye and head movement, and it also helps restore normal function and coordination between your equilibrium and your balance system. So it works by providing like repeated exposure to kind of a noxious stimulus that kind of recreates your symptom to help your brain adapt and learn how to compensate and move forward and improve your balance. So equilibrium is basically like a three-legged stool. So there's three parts: what we see with our eyes, what we feel with our feet and through the sensors in our joints and our ankles and our lower leg and in our neck, and our inner ear, our vestibular system. So the three of them work together to send signals to the brain, and the brain then talks to our muscles to keep our balance, keep our vision focused, and help things stay nice and stable.
Okay, so we talked a little bit about being dizzy as one of the symptoms. What are some, in addition to that, what are some of the other conditions that may be a call for this rehabilitation?
So the most common symptom is called benign paroxysmal positional vertigo, commonly known as BPPV, or the rocks in my head got in the wrong place. That is actually the number one cause of vertigo in at least 50% of the population age 70 and older.
Oh, really?
And so that's the primary inner ear condition that would benefit from vestibular rehab therapy. We can also have dizziness or symptoms from concussion, inner ear infections or inflammation, benign tumors in the inner ear. Also Meniere's disease, some non-inner ear issues are migraines. Could also come from Lyme's disease, lupus, or even diabetes can result in some imbalances that would benefit from vestibular rehab therapy.
Interesting. Okay, so what are some of the benefits of vestibular therapy being done at home?
The beauty of having it done in the home is that it creates a safe environment for the patient to receive the treatment, especially if they are afraid of falling or they're at an increased risk for falling, and it's a hardship for them to leave the home and go places. So we can come to them, we can do an evaluation and determine the cause of the dizziness and provide a comfortable in-home treatment of some repositioning maneuvers if it is that BPPV, or we can jump right into those adaptation or those habituation exercises to help restore that balance and coordination.
Okay, so if someone thinks they or a loved one could benefit from this therapy, what do they do to get a referral to go to TidalHealth?
It's super simple. You can talk to your medical provider about it if you have an upcoming appointment or just saw them recently, and ask them for a referral to TidalHealth Home Care, or you can call our office directly and we'll be glad to help set that up for you.
Very interesting. And it sounds like something I know a lot of people could benefit from, because when you get dizzy, no matter the cause, it's not right. It's scary.
Fun. It's super scary, and dizziness is actually the #1 complaint of all people over the age of 70. Some form of dizziness, whether it's related to a heart issue, medicine, or inner ear condition, and it really affects quality of life.
Yeah, I bet. Colette Alton with TidalHealth Home Care, thank you so much for joining us this afternoon.
Thanks for having me.